The Health and Human Service and Aging Committee is now called to order. Chrissy, would you please call the roll?
Calling the roll, Mr. Jones.
Here.
Ms. Conwell. Ms. Conwell is absent. Ms. Brown. Here. Mr. Schron.
Here.
Mr. Miller.
Here.
We have a quorum.
All right. Has anyone signed in for public comment?
No, Mr. Chair, no one has signed in.
All right. Can we have a motion to excuse our colleague, Councilwoman Conwell?
Second.
Moved and seconded. All in favor say aye.
Aye.
Aye. All right. At this moment, we'd like a motion to approve our minutes from the March 18, 2015 meeting.
So move. Second.
Moved by Councilman Schron, seconded by Councilman Miller. All in favor say aye.
Aye.
Ayes have it. All right, well, we have one item on our agenda today that has been referred to committee, Resolution 63. Chrissy, please read that into the record.
Resolution 2015-0063, a resolution authorizing amendment to contract number CE 1400215-01 with AmeriCab Transportation for transportation services for the period 9/1/2014 through 8/31/2016 for additional funds in the amount not to exceed $4,400,000, authorizing the county executive to execute the amendment and all other documents consistent with this resolution, and declaring the necessity that this resolution become immediately effective.
Mr. Math, would you like to speak to this matter?
Good afternoon. I'm Bob Mack from Job and Family Services. This is an amendment to our current existing contract we have with AmeriCab Transportation.
Oh, I thought I was on. Oh, there you go, much better. It's an amendment to our existing contract with AmeriCab Transportation. And we need to add some dollars to this contract due to increased utilization. Back in May of 2014, we issued an RFP for the service, and the service is about providing non-emergency transportation services to folks who are in receipt of Medicaid but need assistance to get to and from medical facilities. And the primary folks that utilize this service are individuals that need to go to regular appointments for dialysis, chemotherapy, radiation, methadone treatment. So due to the increased utilization, we need to add some dollars to the contract. This service is 100% funded through Medicaid dollars, so it's literally just a pass-through to the county. This was a 2-year contract. It ends in August of 2016. But based upon the current utilization, and we have some figures, the $3.6 million that was awarded for the 2-year contract was based upon previous utilization over past years. This year, we project by the end of this first year, the contract will exhaust almost all of the $3.6 million already. And so we need an additional roughly $4 million to continue it through the end of the term of the contract in August of 2016. Just to give you some sense, we've experienced already just in the first 6 months of the contract a 70% increase in utilization. And again, these are all folks that are on Medicaid that need the service.
Mm-hmm. So we're looking at a $4.4 million in additional funds.
That's correct, Mr. Chairman.
There are some funding sources where, I'm going to say food stamps, where that is an entitlement and you will always meet the demand. Then there are other financial funding sources where there's a limit.
Yeah, there's no cap on this. So we just, the folks that need the service, we provide the service, and then we get reimbursed 100% of the cost.
Okay. How many individuals have we served over the course of the contract?
Well, just through the first 6 months of this year, we've already served 650 folks. This time last year, we served 370 folks. So you can see the increase in utilization. And even the number of trips, the contract is based upon a unit rate of $14.82 per trip. And of course, so each trip is, of course, it's two-way. But this year, because of the increased utilization, some of the treatment now, especially unfortunately, some of the folks that are in receipt of methadone treatment, they have to go 7 times a week, by their physicians. So the increase is really dramatic.
Can you repeat that unit amount again?
It's $14.82 per one way.
Per one way. Okay. Questions from the committee? Councilman Schron?
What do we do obviously these are pass-through dollars, so they're not
directly affecting our county's budget. But what do we do to monitor the taxpayers' utilization of these funds to make sure that these are all trips that make sense? With this kind of growth in expenditure, what are we doing to protect our taxpayers' dollars at the federal level where this is flowing through?
Yes, Councilman, through the chairperson. These are all this is all under the doctor's care. So the physicians provide that, they have to provide documentation that these folks need that treatment.
Okay.
So we rely on the doctor's, assessment of their medical condition.
And what do we have to compare this price of $28 basically round trip, actually $29 round trip, with other sources of providing the same kind of service?
We issued a competitive, we issued an RFP through a competitive procurement process. And for this last RFP, they were the only respondent to the RFP. In the past, we had several respondents, but they came in the past, they were always the lowest unit rate.
And there's no other way of getting the patient to the doctor other than using a private taxi service?
That is correct, as far as we know.
Bus service, nothing else, van, any kind of alternative vehicles?
No, we looked at other alternatives. This is really the most probably cost effective, because a lot of these folks would be handicapped by trying to take, public transportation. And especially some of the facilities they're not always as accessible, and depending where the folks live.
Thank you.
And it's not a shuttle in the sense if they were going to a senior center, they may do a trip to 3 houses or 4 houses in the community and put them on, but you're literally talking about one person going to get chemo.
That's correct.
So, who were the previous bidders or contractors, or more specifically, speak to what thoughts you might have to why we only have one vendor bidding when you had multiple vendors bid in the past?
Mr. Chairman, that's a good question. I don't know. In the past we had, I think it was just, there's only several cab companies in town now. And some of them just don't have the capacity to deliver the volume of services that we project here, So it's hard for me to speak why other people didn't respond. They were all notified of the RFP.
How many were notified? That's that buy speed.
Yes, through BuySpeed, yes.
Usually there's a number attached to the buy speed. In Public Works, we always saw a number of those notified who will actually push the contract opportunity.
Do you recall offhand?
No, I think there are only about 3 or 4 people that can provide the service, the cab companies at the time.
Okay. Oh, yes, Councilwoman.
Perhaps you can clarify the number calculation. You said 650 people have been served this year. Is that correct?
Yes, for the first 6 months, yes.
And according to what you said, we're looking at about a $29 round trip cost.
Yes.
Okay, and if and of those 650 people, they don't all use the service 7 days a week. Is that fair?
No,
to say?
those 650 people they made 16,800 trips.
16,800 trips, yes, because the calculation came roughly to
Yes.
about 135,000, even if we capped them out at 7 times, every 7 days a week round trip for the 650 people. So I'm wondering, is there some additional cost in this number that is being presented?
No, each one of those trips is a one-way trip at $14.82. So the 16,800 trips times the $14.82.
Another way as opposed to just the 650 people, like with dialysis, you might go 3 days a week.
On the average, that's what they do for about 3 days a week.
How many trips do you provide for 4.4 million, or you provided for the?
Well, for those, so if they have to go for dialysis, say 3 times a week, that's 6 trips, It's to and from.
And if you don't have the number, but do you know how many trips you provided over the length of this contract?
In the past year, I know I just had it for the first 6 months of this year, and 16,800 trips.
Councilwoman. Councilman Miller?
Yes. If you take, so you call it 17,000 trips, and at $30 a trip, round trip, or this 17,000, is that round trips or individual trips?
Those are individual trips.
Okay, so it's about $15 a trip. It comes out to something like 225,000, which is it's a long way from that to 3.6 million. I'm wondering where the rest of it is.
That's, I stand corrected. That 16,000 was for the month of February.
I see.
I apologize.
Okay.
I'm sorry, I thought.
Okay, so that's for one.
So that's just $250,000 just for the month of February.
Just for one
I'm
month.
sorry, I
Okay.
apologize.
Okay, right. And how much of the money actually goes for the trips, and how much does it cost to administer the program?
As far as we know, it's 100% goes to, 100% goes to the provider. How much, what it costs them to operate it, I
Oh,
can't
okay,
answer
so
that, yeah.
we're only paying for the trips, and we don't have any significant administrative costs.
That's all built into the trips.
Okay.
There's no additional dollars.
And I would generally say that, well, first of all, there's just an explosion in demand for government services, whether the economy's getting better or the economy's getting worse, and I share the concerns that Councilman Schron expressed, my question would be whether you can give us some understanding of what's led to the huge expansion in utilization. Is it people becoming more aware of these services, or is it that the population's getting older, or is it that there's more chronic illness? Or can you give us any understanding on that?
Councilman Miller, through the chair, I think honestly it's a combination of all those factors. Clearly, the expansion of Medicaid contributes to that, because more and more people are eligible for the service. What we've seen this past year is one of the reasons for this significant increase is the number of folks that are receiving methadone treatment. Because they require, initially it requires 7 visits. It's a 7-day treatment program, which is 14 trips. So that's the biggest difference we've seen from this year from the previous year. The individuals that are going for dialysis and chemotherapy and radiation, these other, ambulatory customers, that's been relatively flat. I think our major increase has been as a result of some of the drug-related issues.
And Mr. Chairman, is the methadone treatment ongoing with no endpoint, or is methadone treatment typically for a certain length of time, and when that time is done, hopefully the need for the treatment is done?
Well, Councilman Miller, I would have to defer to maybe the chemical dependency experts. I think there's an end to everything, of course. I think how long people are normal stage, somebody's on a methadone program, I don't know for sure. But clearly the whole idea of those programs is to wean these folks off of methadone as well. Whether that's a 7-day program or it's a 7-week program.
Well, my only other comment is that it just reinforces how significant chronic illness has become. I would presume that that you get a relatively small number of the trips are for acute type treatments, but that the vast majority is for treatment of chronic illness, and it just is a huge and growing problem in our country, and this reflects it.
I believe so.
And to Councilman Miller's point, our senior population is growing, and their needs are incredible amount of need. My one thought here is this program is being administered through Jobs and Family Services. Why through Jobs and Family Services and not Senior and Adult Services? Which on the surface seems to me like it would be the more ideal organization to,
Well, we're responsible for administering the Medicaid program.
okay.
So when folks apply for Medicaid, they apply through Medicaid through Job and Family Services. And that's where we're made aware of the other services that are available to them.
Are
And
there-
I don't know what the breakdown is in terms of the demographics of the users of the service, in terms of the older population versus the younger population.
Are there strengths that the Department of Senior and Adult Services could bring to bear if this was administered through them? I'm hearing you say maybe it's not possible, but theoretically, is there advantages?
I suppose theoretically there might be, but as the administering agency of Medicaid, it falls under the purview of Job and Family Services.
I think Councilwoman. Yes.
I just wanted to clarify, this is indeed a state-funded program. We're just a pass-through, so we'll be refunded the money. And if that is in fact the case, is there any situation that our reimbursement would be denied?
Councilwoman Brown, no, it's 100% reimbursable. And it's federal versus state.
Councilman?
The $14.80 per trip, is there, to Councilman Miller's question, there's no admin cost any place in that $14, or is that enough? It's just hard for me to believe that someplace there's not an admin fee being put into that for our pass-through, for us to touch the transaction.
Councilman Schron, I trust when AmeriCab bid on it, like any other service, they build their administrative costs into that $14.80.
I'm not talking
I
about
don't know what it
theirs.
is.
I'm talking about from us to be the conduit for
I
this
understand.
to go through.
None.
So
There is no administrative fees charged this at all. It's something we just administer.
We're processing 4.4 million on this contract alone, and we do that for free.
Ultimately, yes, but we get administrative dollars, in a pool of dollars that we disperse across all our programs. So ultimately, there's somebody, through our TANF and Medicaid reimbursements, some of those costs ultimately are absorbed, our administrative costs, because it's an allocation pool.
Okay, but the allocation pool change as a result of what you're telling me, or telling this committee, is that you more than doubled the amount of workload that's flowing through this committee, through your activity just to support this one action itself. And now you're here asking for another 4.4 million to pass through, and that doesn't cause additional administrative responsibilities. How many times can the federal government keep coming back and just saying, well, this is covered by your currently admin fee, this is covered by current, every one of these contracts that we process that more than doubles the load, at some point has got to start hitting us in personnel matters.
Understand?
And you're telling me none of this is, at this point, this will have no additional burden upon your department to process now 16,000 transactions just in the month of February alone.
We've maintained our same staffing level to do that.
Okay, well, let's
Understand your point.
Yeah, well, let's go into just for my own edification. My good councilwoman asked about any possibility of not being fully reimbursed. What will happen when the federal government starts ratcheting down the Medicaid reimbursement percentages that they've already announced that they're going to do? Will that affect this $4.4 million, because there'll be a direct correlation between those Medicaid dollars coming through, because with Medicaid expansion, will there be a direct correlation between the transportation that's associated with that same dollar? It's getting ratcheted down to what, I believe 90%?
Ultimately 90%, I believe.
Yeah. When that happens, will we be responsible for picking up 10% of this transportation as we would either ultimately through the state or the state's, I mean, the likelihood is the state's gonna pass it through to the county.
Sure.
So therefore, the county, will we be responsible for picking up the 10% transportation on that also?
Councilman Trahan, that's a fair question. Unfortunately, I don't have the answer to that. We won't know until, I suppose, they do that. I mean, we know that to date, it's 100%, it always has been, you know, so how that may
For a
change.
year, so
What's that?
it's only been in place for a year, so
I know.
always is not a long time.
No, I know, I understand, you know. But until that happens, I surely don't have the answer.
Well, we surely need to find out.
Understand.
Because if we're gonna be, if we as a county have to budget for that, I can only believe that the state is not gonna say that for those 16,000 transactions that took place in the month of February, that the state is somehow gonna be responsible for it. That I just can only envision it's gonna be a pass-through. And it's gonna hit our budget, and it's gonna hit us in an area where some of us were kind of warning this might happen. So I think we need to be looking at
We will.
this with sincerity, not now. I mean, not when it takes place, but right
Today.
now.
I understand. We'll look into that.
Thank you.
So what actually happens on the ground is the AmeriCab will transport an individual and then bill the county. Is that how it works? They're gonna bill the county?
Correct.
And obviously 16,000 trips in 1 month, and they bill us. So the administrative was something that your department can bear, even though it is double.
We have and we are.
Any other questions from the committee?
Yes.
Councilman Miller?
Can you explain the process by which an individual would line up a trip? Do they go directly through AmeriCab, or do they have to go through us and then we have to link them with AmeriCab? How does this work?
Yes, Councilman Miller, they would come to one of our caseworkers with the appropriate documentation from their physician indicating this is the treatment they need and where they need to go. And then we provide the voucher to AmeriCab.
Okay.
Any further questions?
One more question.
Councilman?
The question is whether there's a need for this legislation to be passed under suspension.
Is there a speed to your request?
Is there speed? No. We have, obviously the contract's a 2-year contract. All right. We're anticipating, needing these additional dollars for the second year of the contract. So today there's money in the contract to cover, the cost of the trips.
Okay, fine.
Also, with that, so you are covered through 2015, this, as far as the dollars that you already have available, you don't anticipate tapping into these dollars for another, 8 or 9 months?
No, in all likelihood, we'll expend the $3.6 million within the first year of this contract. That's why we're doing that amendment now.
So the first year of the contract would take us to 9/1/2015, so we got a little while to go yet.
Yes.
Okay.
You don't think that?
You got it, but I still haven't gotten it. Yeah. What you're saying is, this amendment, the dollars from this amendment, the dollars you currently have now will hold you, the demand that you have, and you will start to tap into these contract amendment dollars in June, July, August,
Yeah,
2016?
Mr. Chairman, the way that's set up fiscally, that they budgeted 1.8 million for each of the 2 years for the 3.6. So the 1.8 million is really only budgeted for 2015. So that's why we need this amendment, because, those dollars will be exhausted before the end of the contract of this first year. Because the way the contract was, the way it was set up in fiscal, that they budget 1.8 million for the first year of the contract and 1.8 million for the second year.
And the second year is 2015,
2015, 2016.
and this will cover. Maybe I'm being slow.
Mr. Chairman, the way I understand it is they've exhausted the first half allocation before the end of this year. If it goes at the same kind of pace that is anticipated for the second year, that too will be exhausted before halfway through the second year. And so they need these dollars to piggyback on both years. Is
That's
that-
correct.
is that-
That's correct. That's correct.
So the fundamental question is, can we go through 3 readings? If we do not suspend our reading, allow it to go through the 3 reading process, which will put us on the agenda for the 4th Tuesday of this month? 2 more meetings?
Yeah, that should be fine.
Fine. Okay. All right. Any other questions? If not, I'll make a motion that we move this resolution to the full council.
Second.
Moved and seconded by Councilman Miller. All in favor, say aye.
Aye.
Ayes have it. Thank you now, Mr. Mayor.
Thank you.
Our miscellaneous business, we have a presentation by the Council on Older Persons.
Good afternoon, council members. My name is Janice Ziegel, and it is my privilege to currently serve as the chairperson for the Council on Older Persons, which is fondly referred to as COOP. COOP is actually under the Center for Community Solutions, which I'm sure you are familiar with. And I'd like to acknowledge members of COOP who are here in the audience today who wanted to participate in this meeting and this opportunity to share COOP with you. I want to spend a few minutes this afternoon to talk about our history, our mission, some of our guiding principles, and also some of our priorities for 2015. COOP was established approximately 85 years ago under what was known as the Welfare Federation, which is now the Center for Community Solutions. Again, I'm sure you're aware of the good work of Community Solutions in identifying community issues, analyzing and explaining them, and proposing nonpartisan recommendations. COOP, the Center for Community Solutions, assists public officials, nonprofit organizations, and private sector entities in critical decision-making required in public policy-making processes. There are a couple of funders for the Council on Older Persons, which include the Center for Community Solutions, the McGregor Foundation, the Cuyahoga County Division of Senior and Adult Services, and I want to acknowledge the invitation of Director Mason, who facilitated this presentation today. Benjamin Rose Institute is also one of our funders, and the Western Reserve Area Agency on Aging. As funders in COOP, each of these entities also has a place on the steering committee of the Council on Older Persons. The purpose of COOP is to study the field of the care of aging in our community, make recommendations for improvements of programs for older persons, analyze available resources, and be influential in meeting the needs of older persons. Our guiding principles are really about education and advocacy. We want to educate legislators, policymakers, and those who support the aging and disabled populations, build cooperation and coordination between government, community groups, and other entities, and respond to pending legislation, regulations, and policy changes. Our structure is we are a citizen-led, nonpartisan group where no one voice or organization has overriding power. We truly do speak as one voice for COOP. We now include representatives from the younger disabled population, and currently there are 47 members on the Council on Older Persons. Membership is individual. It is not based on organization or affiliation. And I am very proud to be associated with this group because when we have a meeting, pretty much 47 members show up and participate. The full COOP meeting body meets about 5 times a year and as needed, but we do have a number of committees that are more active than the full membership. Our steering committee, our legislative committee, the program committee, and the nominating committee meet various times throughout the year to move agendas forward. Every year, the committees collaborate on a yearly action plan, which is then agreed and approved by the membership. And again, that's focusing on education and advocacy efforts. Some of the areas that we have concentrated on include elder abuse, neglect, and exploitation, Medicare, Medicaid, and other healthcare, housing, long-term care, pension, and Social Security reform. Some of the accomplishments of COOP, and there really is a long list of accomplishments, and I'll just mention a few. They initiated a partnership between Benjamin Rose Institute and what was previously known as the Golden Age Centers of Greater Cleveland. That went back to 1949. Those two groups are now combined, and the Golden Age Centers have become the Rose Centers on Healthy Aging through Benjamin Rose. COOP initiatives have led to proposed language that became the Ohio Guardianship Law and subsequent amendments, and also the Ohio Adult Protective Services Law. And COOP membership also advocated to secure resources for passport funding initially, and also for full funding in 2003 and 4, and the county-based options program to bridge funding and provide permanent funding for people who don't qualify for passport but qualify for options. COOP has secured a seat, an appointment to the Job and Family Services Adult Protective Services Funding Work Group, which is a relatively new initiative at the state level. COOP has sponsored the Elder Abuse Awareness Day in Columbus, and we also co-sponsored the County Executive Candidates Forum in 2014. A few of our priorities moving forward, and one of the reasons we're here today is to establish a collaborative relationship with County Council, the County Executive, and the Department of Senior and Adult Services, and have COOP be a part of that. To conduct community educational forums on relevant aging issues. We have a few of those coming up in the next month, with the White House Conference on Aging actually holding a listening session here in Cleveland. To participate in public policy processes on local, state, and federal levels. We also want to mentor young professionals who are working in the field of aging. So when we have moved on, there will be an appropriate workforce to pick up the banner and continue the work. And we also actively recruit new and diverse members to COOP membership. Contacts aren't showing up here, but I'm sure you have my contact information in your packet. When I am not serving on COOP, I am the Executive Director of Senior Transportation Connection, and I was quite interested in your previous conversation. You may also contact John Corlett, who serves as the President and CEO of the Center for Community Solutions. But I would welcome any questions that you may have for me or any of my COOP colleagues who are present here today.
And Ms.
Ziegel,
Ms.
yes.
Ziegel? Well, first, thank you for coming today.
My pleasure.
When I assumed the chairmanship of this committee, I was inundated with so many organizations that wanted me to physically come out and tour with their operations and all those things. And I said to our staff and Levine Ross, Levine, I need you to coordinate this. And he said, I may not be able to physically go out to everyone, but let's make an effort to set up meetings, provide opportunities in committee in this setting, and tour where I can, but do it in a structured way as opposed to me just trying to respond to every phone call, email, and letter in the mail. So you are part of that process, and I don't know if this was accidental or I should just give full credit to Levine and as having brought you at a time when this particular contract, I think, was so close to what you do. Let me take a moment and ask you, as you listen to the discourse on this contract, were there any thoughts that come to your mind? Any questions we didn't ask or could have asked? Or
And they left.
they've left. No, I know where they went to, so it's all right.
Well, Mr. Chair, without really having a close look at the contract, I really can't answer specifically. However, to share with you, based on my experience, transportation is an expensive service to provide. Cab services have some advantages over other providers like my organization, like Provide a Ride, like public transit, because they have a larger fleet of vehicles and can be more easily dispatched. That may be one of the reasons why the cab company was responsive to the RFP. I think there are other issues, though. One that always crosses my mind is an issue of accessibility, because cabs are typically not suitable for people with mobility disabilities. Canes and walkers may be okay, but you may have some issues with people in wheelchairs. Cab companies also have an advantage of probably being able to cover a larger geography than some other nonprofit or other specific organizations. But I hope to come back at a future point and really talk to you about Senior Transportation Connection. Currently, we are in 26 suburban municipalities, the city of Cleveland, and we work with another number of nonprofit organizations.
Thank you. Are there any comments or questions from the committee? Councilman?
I was gonna open that same door, that.
I sort of saw it coming.
Yeah, sorry about that. It's just bad karma that you got drawn on this lot today. What do you actually pay for a round trip?
Oh, boy. Actually, our rates are covered in we are a contractor, so we work with those 26 suburbs and other agencies. And our rates really are based on group transportation versus individual transportation, because you're going to be more cost effective when you have more people on the bus going to the same destination. Your example, Mr. Chair, of senior center or community center transportation. Well, that's going to be at a much lower cost than an individual going to a prescribed physician's appointment at a particular time. I would give you a cost estimate of anywhere from as low as $7.50 a one-way trip to as high as $25 a one-way trip. And again, we're factoring in distance, we're factoring in fuel costs. I mean, there's so many things that go into figuring out what a trip costs. That 14 odd change rate is probably somewhere in the middle of what we're seeing in the industry.
Okay. But the ability to do, if you have a known methadone treatment going on every day for 7 days a week with a series of people, it just, to me, putting my business hat on, just calls out for a more unified approach that because you're taking people there and perhaps you can pick them up and drop them off because they're probably all going ultimately at the same facility.
And ultimately within a reasonable time frame, yes.
Yeah, right. And if it's out, you can certainly, hopefully, maybe structure it because let's face it, one of these days it's probably going to drop on our table. And your smile tells me everything that my questions were not out of line for anticipating that we're going to be looking at picking up these costs at some point to some degree.
I think it's also important to note that Medicaid is a big funder of transportation services. So I can't predict the future, but we will hope they will continue to support transportation so people can access health care and treatment, behavioral health, whatever, because it is so critically important. And if people don't get access to those services, we create a whole nother set of problems that we're just dealing with in other places.
Thanks.
Councilwoman?
I was just curious as to the percentage of funders, who provides what percentage to the Council on Older Persons? Is that available?
I don't know, Verna, if you have that? I believe among the partners, first of all, I believe the Center for Community Solutions provides most of it. We know the A.M. McGregor Foundation grant this year is around $7,500? Oh, it's 10,000. And then each of the other partners, the Western Reserve, DSAS, the Area Agency on Aging, pay an equivalent amount, but I'm not certain, Councilwoman, how much that is. 5,000? $7,500 from the county. And those funds are used to support the staff costs, meeting arrangements, any advocacy materials that are produced through the center.
We know the challenges. I'm sorry. We know the challenges that many senior centers have faced around our county. Some are still struggling to survive, and some have had to shutter their doors. Can you share part of your package talks about the public policy making and the advocacy? Can you speak to the issue?
I believe I can, Mr. Chair. At every COOP meeting, there's a couple of things that happen. One, we are apprised things we need to know about on a national and state level. And then there's usually some presentation about what is going on locally, as there have been concerns about the closing of the senior center in East Cleveland. We heard a serious threat of the closing of the Maple Heights Senior Center. And a COOP as a membership is concerned and asking, what can we do so those things don't continue to happen? I understand some of the COOP members are currently involved in looking at how to address getting services back to East Cleveland, because we know that a very vulnerable population was left very quickly without services. So those things do come to the attention of COOP as a membership, and we, in discussion, talk about what can we do, what should we be doing, how can we assist in finding resources so that those seniors in our community continue to be served.
Any other questions? If not, well, Ms. Eagle, we thank you. We appreciate you coming by, and we have your contact information.
You do.
Let's make sure we have that, and let's continue to stay in contact with one another.
I look forward to that.
All
Thank
right,
you.
Thank you. Did you want to introduce any of your
I would just
colleagues?
like to ask my colleagues, COOP members, to stand. So that you remember, we have our legislative chair here, our program committee chair, and Verna Rafe Beamel, who is actually our staff person from the Center for Community Solutions.
All right. Again, thank you all for coming.
Thank you.
Thank you. Chrissy, has anyone else signed in for public comment?
No, Mr. Chair, no one has signed in.
No one signed in. All right. All right. Well, if nothing else holds our attention, this meeting is adjourned.